Here at the MedStar Orthopaedic Institute at MedStar Health, we have a breadth of services for people that need joint replacements. So obviously we all know about total hip, total knee replacement. We also have total shoulder replacement, total elbow replacement, and total ankle replacement. Amazingly, all of those joint replacements can be done safely and effectively for many patients in an outpatient setting.
In orthopedics, there is this shift from traditionally inpatient surgeries to outpatient. At MedStar, the majority of those are hip and knee replacements, but we also have shoulder arthroplasty cases, foot and ankle replacements, and then spine surgery has a subset of patients that are benefiting from going home the same day.
When I first started in practice, patients would stay 7-10 days after surgery, to the point now where we've gone from 7 to 10 to 4 to 5 to 2 to 3, and now most of our patients are going home the same day.
I've had not one but 2 knee replacements at MedStar Health. I had the first surgery done on my right knee, spent the night in the hospital, and they took very good care of me. But when it was time for me to go home, I was ready. I was ready to make that decision and go home and start the healing process. My surgery on my left knee was different than the right knee. I was able to go home the same day, and that was through the discussions with Dr. David Gold.
When we first started promoting outpatient surgery, there was a lot of surprised patients and family members. You know, they're used to the old way of doing this with several nights in the hospital. What's interesting is as we started this and patients started to hear about it, there were many patients who said, I want to go home and I'm interested in this. So it wasn't a difficult conversation. They just wanted to know what to be aware of and what to be concerned about.
With the advances we've made at the time of surgery, specifically in pain management control and anesthesia around a surgery, we've developed these rapid recovery protocols that allow patients to get up and moving quickly after surgery.
The benefits of going home the same day are that it is certainly always better to recover at home. Hospitals in general, and our hospital is a great place for healing, but they're also a place for sick patients. Our total joint patients are not sick patients. They're well people that have a bad knee or a bad hip or a bad shoulder. So they don't need to be in an environment with other sick patients.
In select patients, they are just as safe going home the same day of surgery as they are staying in the hospital. Numerous research studies and literature in the past have really shown this to be true, and it's also been our experience at MedStar that patients do just as well and are just as safe going home the same day of surgery.
It's a huge step forward because patients can go home to their home environments. They have control over their pain medication, their regular medications, and they're more motivated to get up, walk around, and start taking care of themselves right away. In fact, I saw this with my own mother, who had a hip replacement done as an outpatient very recently. We brought her home, she was up walking right away, she was eating better, and she just really recovered fantastically.